The Frailty Emergency Squad, or FES, is a consultant-led MDT-delivered service which provides early, comprehensive geriatric assessment to frail, older people within the emergency department. As a multidisciplinary service, the FES has advanced clinical practitioners, physiotherapists, occupational therapists, emergency floor discharge specialists, and an advanced pharmacist within the team. The 7-day service operates between 8 a.m. and 6 p.m, providing input for older adults with a frailty syndrome such as delirium, dementia, falls, polypharmacy or Parkinson's disease, and a clinical frailty score of 4 to 6, or any older adult with a CFS of 6 to 9. Frail older people are the fastest growing cohort of patients attending ED, but often have a prolonged length of stay and greater risk of adverse outcome with hospital admission. The focus of the FES team is to assess patients who could potentially be supported in the community and avoiding an unnecessary admission. If a frail older patient clearly needs admission, for example sepsis, we do not necessarily need to review the patient in ED, but we are happy to discuss any frail older person if you have any concerns. All older adults should have been assessed by the ED medical team prior to a referral into FES. Additionally, all necessary investigations and imaging performed, referrals or discussions with relevant medical specialties performed, and an adequate analgesia provided. This will save time and ensure a timely FES assessment. The advanced clinical practitioners within FES provide the medical focus of the comprehensive geriatric assessment, working alongside the geriatric consultants. They provide an individualized, patient-focused approach to frail older adults assessment, adopting a problem-based approach, managing comorbidities and focusing on what is important to the patient. We often initiate discussions with the patients and families about advanced care planning and suitability for further investigations. FES facilitates safe discharges in frail older patients from the ED. We often refer on to community services and arrange outpatient investigations to facilitate discharge home. We are also able to access community hospital beds directly for those patients requiring rehabilitation. If you wish to request input from the FES ACP and geriatric consultant, please make a FES electronic referral via Nervecentre with the specific clinical question you would like to be addressed. The pharmacist within the FES team will start by establishing a patient's medication history. This is confirmed by using a number of sources, including the patient, their own medications brought in from home, GP records, family, carers, community pharmacies, and previous discharge letters. The pharmacist will also check if the patient uses any herbal or over-the-counter medicines, as well as any allergies. After gathering an accurate medication history, the pharmacist will then review the medication for inappropriate polypharmacy. They take into account factors such as anticholinergic burden, patient's compliance, blood results, EWS, the patient's presenting complaint, among others, before making suggestions to the team. Examples of recommendations include stopping of antihypertensives due to a postural drop in BP and reducing doses of medications based on guidelines, tolerability and compliance. When reviewing patients in ED, if you notice a patient takes critical medicines which are very much dependent on time, such as Parkinson's medication, epilepsy medicines, antibiotics, anticoagulants, please can you ensure that they are prescribed regularly for patients so they are not missing multiple doses whilst in the emergency department. It is also important to highlight the need to prescribe patients analgesia if they've been admitted with an injury, for example a fall. The emergency floor discharge practitioners, or EFDP for short, assist with complex discharges and aim to avoid hospital admission whilst supporting safe and timely discharges. They have direct access to community hospital beds for medical step-down, rehabilitation and palliative or end-of-life care. They will liaise with county and social services in order to make referrals for packages of care or organise going to a care home. They will also make referrals for district nursing and for community services. In particular, they can assist with rapid discharge to support with end-of-life care at home, ordering essential equipment and oxygen, and making referrals to the Integrated Community Specialist Palliative Care Team. The EFDPs will also carry out a review of patients who have been safeguarded, working alongside UHL and social services safeguarding services to resolve barriers to discharge. The therapy team consists of physiotherapists and occupational therapists. The therapist would initially identify a patient's baseline through speaking with the patient, utilising a wide range of resources and speaking with next of kin or carers as able. Once it is clear what someone usually does at home, they would carry out assessments of mobility and transfers, identifying whether the patient is able to care for themselves, highlighting any issues with cognition and reviewing any falls risk. The therapist will identify any additional needs in order to facilitate a safe discharge. This might be referring for an emergency package of care, issuing equipment to aid mobility and transfers, or making onward referrals to community and outpatient services. Consideration is also given to the carers and whether there is any carer strain or an element of not coping at home. Alongside the rest of the team, therapy will identify the safest discharge destination, be that home, community hospital, care home, or a specialist facility. If you are unsure which member of the FES team you require input from or require input from numerous team members, please just use the generic FES electronic referral. If you are able to be specific in your e-referral, it will save time and support a swifter assessment. The FES team are happy to help with any element of care of frail older adults. Please speak to us in the FES office opposite Bay 17 in Red Majors.